Well, hello everyone. This is Dr. Ellithorpe with Tustin Longevity Center. We had a 10-minute delay, some technical problems, but it looks like we got that all solved, and hopefully others will check back in. Not quite sure what happened, but thank the Lord, Talon, I got a hold of him, and he runs the place, and he got it all fixed for me. So I said, hello, sorry for the 10-minute delay. We'll start now. Okay, and this is August 15th, 2022. This is Tustin Longevity Center. I'm Dr. Ellithorpe, and these are our Monday night at 6 o'clock talk to the doctor. Here's where we try and answer in general how a functional integrative doctor trained in regular medicine as family doctors, gynecologists, naturopaths, physician assistants, how we would approach many of the common questions that come to us regarding natural issues in their life and how they might try and handle these. And this is not meant to replace your doctor or be medical advice for you personally. Even if you happen to be someone watching who is a patient of mine, I don't recognize the name necessarily. And I would ask you if you had any particular question, and I try and give a generalized answer here, that you would call the office if it's urgent to you at 714-544-1521. So now let's see. I have the several questions. I had some left over from our last visit, and I'm going to go over these as quickly as I can. And this is from last week on the 7th. So Elena asked, after having abdominal pains for the last 4 months, ending in the ER, having a CT scan, ultrasound, and MRI, my husband and I were told I have multiple uterine fibroids, 2 being in the 7-centimeter range. We do not have kids yet, and this has been concerning news. Is there something that can be done to reduce the size of the fibroids or even make them disappear? I'm in my early 30s. We were told about you by Phyllis Kampa. Thank you for your time. In general, fibroids come from eating too many carbs, hidden high fructose corn syrup, which stimulates insulin, and that stimulates growth. And the uterus is very sensitive to growth in the lining, and estradiol is one of the growth promoting hormones to get the lining ready every month for a possible implantation of a fetus. Now, when we eat a high carb diet, the insulin stimulates that, and you can get fibroids to form. When you are under stress and it's a stressful world, we don't ovulate. Cortisol psycho-emotionally can overwhelm the follicle stimulating hormone to have a follicle develop and produce progesterone every month to clean the uterus out like it should be every month. And so progesterone loss is another problem that is associated with endometriosis, fibroids. And so I also would point out lack of enzymes, systemic enzymes, and lack of water, lack of exercise, and lack of good sleep, and lack of iodine. So I would recommend using progesterone for my fibroids patients. I give them the patient 200 milligram capsule of progesterone. Sometimes I use 400 milligrams, and I use it day 15 through 25 of their menstrual cycle. This will create a nice clean out. Even the flow may be heavy for the initial cycle that you use it. And so 15 days from the start of a menstrual cycle is when I use the progesterone. I put them on 12.5 milligrams of iodine a day. I ask them to be on a keto diet, a very low carb diet. I ask them to take in the morning on an empty stomach and before they go to bed at night, systemic enzymes like Vascuzyme or Vitalzyme. These are anti-inflammatory, proteolytic, and they help chop up and chew up this excess fibrin tissue material. And then I ask them to take vitamin D as a general rule and to take good antioxidants. We recommend usually Juice Plus, the fruit, vegetable, and the berry blend, and then a vitamin D and a multi-mineral. The multi-mineral has rich amounts of magnesium that are in a amino acid chelate with potassium. This helps with any cramping and such. That's how we approach it. We follow it up with repeat transvaginal ultrasounds, and we watch the cycle. So use the progesterone for my fibroid patients day 15 through 25 of every menstrual cycle. And that should bring a great resolution to this. Build up your immune system, decrease the cramping and discomfort, and disinflame you, and make you more fertile. The next question is from Liberty Taylor. What do you suggest for chronic every night insomnia? I wake up early in the sun and get in the sun before noon. I do physical activity. I stop eating before 7 p.m. I'm in bed at 10. I use a magnesium supplement, CMD mineral drops in my water. I'm not familiar with those. Sometimes I'm so exhausted I can't sleep, if that makes any sense. Well, if I'd like to, if you were a patient, and your age would be important, and your lifestyle, what you're doing and all. I suspect that you're in your 40s or older, but maybe not. Lack of hormones, lack of estradiol is often associated with insomnia that seems to not respond. But interestingly enough, not drinking enough water also can aggravate insomnia. Having an irritable brain from being mildly dehydrated all the time. Progesterone naturally helps sleep. So progesterone is a hypnagogue, and it can help you go into deeper sleep if you have adequate estradiol levels. Having enough magnesium in the form of a amino acid chelate, so magnesium glycinate, magnesium citrate, these are amino acids that are chelated, linked to the magnesium mineral, and potassium sources. You would want to look at all your electromagnetic material around your bed. You might look outside the wall and see if there's any meters out there that have a lot of electromagnetic irritation. You want to get the lights off and so forth. So that's the beginning, how I would start with a patient with these issues. Damien says, can you talk about probiotics? I made a search for probiotics on Google and found lots of conflicting information, including that they cause weight gain. I'm confused. Well, I would be too. And my statement to you is the world of biome, the gut biome is a rapidly growing, finally, the gastroenterologists and the other researchers are aggressively looking at the microbiome. It's such a huge content with trillions of cells and components that it makes it a challenging effort. But we have been addressing this for many decades, 30 plus years, and we are finding that indeed probiotics actually are associated, some in particular, with weight loss rather than any weight gain. So I would disagree with weight gain. So I'm not surprised you get a lot of conflicting reports, because there's a lot of confusion in the field, and how to isolate what's influencing what when you're dealing with trillions. That's why it really has never been looked at. So you have to put the whole body together when you're talking about a microbiome and probiotics, and you have to have a complete digestive stool analysis. You have to have a complete digestive stool analysis to be able to help with that. The next one was, I just found out that the previous owner of the house I bought a year and a half ago was using Roundup and possibly other poisons on the property and died of cancer that can be caused by these chemicals. I've been in the yard for the past year digging and so forth and getting, dirty and inhaling some of the dirt dust. How concerned should I be about this for my health? What I would recommend is that the longer the distance, you're not actively using it now, so it is not having the concentration more than likely. But I would also say if you take glutathione and extra vitamin C, if you can find somewhere where you can get a vitamin C and EDTA chelation, that would be very important. I wouldn't stress over this. Glutathione and pesticides have been on all of our foods, sprayed on them, drifting even to the organic areas, unless you have an organization that does spectrophoramorphic analysis for organophosphates. So I would relax about it in the sense that we've all been exposed, that we all need to clean up our diet as best we can, take extra vitamin C, extra glutathione to help us detox. The next one from last week was, I asked last week, but did not see the answer, what causes plantar warts on the sole and how to eradicate them? Well, these are usually viruses, and this often develops when your immune system is somewhat depressed. We're eating such a high carb diet that clogs the capillaries, and the pressure and the dead tissues down there make a good environment for virus, fungi to grow. And so you would want to eat a very low carb diet. You would want to drink plenty of water. You would want to do aerobic exercises. You would want to have open-toed shoes if you could. You would want to use, if you have to wear socks, for some reason, the darkness of dark socks seems to be linked with more viral and fungal illnesses. You would want to be on systemic enzymes, probably iodine orally every day. I use iodoral or iThroid, 12.5 milligrams a day. And you would want to put on Argentine silver. This is a watery, tasteless, 23 parts per billion hydrosol silver, which is much more nanoparticulate dense than a colloidal silver, although colloidal silvers do help. Over-the-counter Argentine silver is called sovereign silver, but it's only half strength. Nevertheless, it's still very good. And I would soak the area and put that on morning and evening and see if that's a help with a low-carb diet and systemic enzymes and the other things I mentioned. What are your thoughts about the foot patches and getting all the toxins out? I haven't seen the studies. I do watch the YouTube, and it really frustrates me and wastes my time. I think often I'm looking at these things that say, if you have heart disease, you need to watch this for the next few minutes to save your life. If you have foot fungus, you need to watch this to save your life. If you have type 2 diabetes, if you have, and it just goes on and on. If you have hair loss, if you're losing your teeth, and these are commercials, and I have spent much of my time trying to watch them because I know my patients and friends will watch these and come up with questions. But really, it is commercialism, and we have really handled all these things very well on an individual basis. I have very rarely seen, and it isn't unusual that I will buy something that's advertised and I will test it either on myself or a family member or two. And really, for the most part, these patches and stuff, this is just smoke screens. If someone is no longer a patient of yours, can we still get a prescription for the EDTA suppositories? And the answer is no. That's a prescription medication, and you have to be an active patient for it. Robert Bauer says, I'm not a patient, but I do just chelation at your clinic. I've been doing EDTA chelation preventatively elsewhere for over 20 years, but the drive is now too much. I am nearly 83. Yes, you can come in. We have a walk-in for EDTA chelation. It's at a lower dosage, but if you're consistent, it's quite effective. It's very powerful. Deanna Martinez Narvaez said, I had my first breakout of shingles. I'm 68. I'm under a lot of stress. I did not vaccinate. I had COVID twice. How long does shingles last with the intermittent pain on the left thigh? What supplements are recommended to accelerate the healing? High dose vitamin C intravenous and then oral vitamin C, quercetin, about 600, 800 milligrams a day. I would get that as DHIST, and I would use 2 twice a day. Take optimal amounts of vitamin D, probably in the realm of 10,000 international units a day. I would have your doctor check your vitamin D levels within a month. Lysine is an amino acid, but that's been around for many, many years, and I've never seen lysine alone have any long-term impact. It's a rare case that has given lysine any credit for the control of this. How do I avoid getting shingles again? I take the antiviral medication the doctor recommended to stop the spread of the rash. It did help, and lots of calamine lotion. Well, interestingly enough, ivermectin twice a week has many, many beneficial components to it. That might be something you would consider doing. Quercetin used every day. 600 to 800 milligrams in the form of DHIST. That's what I do. I don't take ivermectin or hydroxychloroquine. I'm just on DHIST. Have peace in your life. Find a way to get find contentment. Deal with the stressors. Your health is showing cracks in it with the stress giving you a breakout and shingles. So you have to deal with your own stress and so forth. The next thing is Dejane Hernandez says, my mother has severe allergies. She sneezes a lot in the mornings and sometimes during the evenings. And she takes medicines to help her with these allergies. If she doesn't, it gets worse. The question I have is, have you worked with anyone who has naturally healed this, where they no longer experience having any signs of allergies? My mother wants to stop relying on medications and start finding other ways to heal. Well, yes, there's skin allergy testing, and we have desensitization drops you can put under your tongue that are homeopathic and natural. There's quercetin long-term use in the realm of 800 milligrams a day. That's what I use, so I don't have symptoms. You might want to look at food allergies, a complete digestive stool analysis, look for yeast and fungi and other things in your bowel that are creating chronic allergic phenomena. We could do the testing or advise you to see someone who's competent in mold testing. Very often molds and having wet spots or former water damage to your home is a chronic source of this. So those are the things that I would suggest. Deanne said she's been taking the Armour Thyroid for years, started adding iodine 12.5 milligrams plus several other new supplements. When I lie down to sleep, my heart is racing. Could it be iodoral or some other supplement? Well, there could be many things, but when you're talking about your heart racing, we need to see a cardiologist to do a Holter monitor, an EKG, a stress test to make sure everything is fine. The other thing that I would suggest is make sure you don't eat late. I would not eat past 6 o'clock or 5 o'clock. I would make sure that you're well hydrated. I would make sure that you're getting enough potassium in your diet, and I would have enough potassium in your diet, and I would have your free T3 to make sure it's not too high. If you're on 60 milligrams of Armour Thyroid, your doctor should be checking your free T3 to make sure it's not too high. And I think I mentioned the potassium is very important. So I would see your doctor and not let that go on without being followed up. Lisa Beltran says, hi, Dr. E. I was in your lab this morning and was greeted with such kindness and professionalism. Thank you, Lisa, for telling us that. And I will tell my staff that as well. Your staff is the best, and I so appreciate them. Have you any knowledge of nicotine gum patches being helpful to alleviate the symptoms of loss of smell taste from long-term COVID? I am not familiar with that. However, I know the nicotinic receptors are associated with smokers, interestingly enough, had less COVID morbidity and illness and death. And so there was some correlation between the nicotinic receptors and having protection from the viral illness and those things that cause the smell and taste loss. But as far as a treatment for that, I've never heard that. I'm sorry. I would have to try and look into something more on that. The next page, Carol Wheel said, my friend was diagnosed with diverticulitis. I'd like to know your recommendations regarding her eating, as the medical recommendations are low fiber. Your diet starts with only clear liquids for a few days, like broth, ice chips, ice popsicles, gelatin, water, tea, coffee without cream, and so forth. What we normally do in the acute phase, if you actually have active diverticulitis, you have the infection of your bowel, and that's very serious, and you have to see your doctor. It has to have antibiotics. It could rupture and turn into a perforation and sepsis and death. So this is nothing small. We would actually say once you've been treated and released from the hospital and there's been perforation, that you need to go on a protocol and work with a doctor that is going to help you to rebuild the lining of your gut. So food allergies and lectins destroy it, so you should have a food allergy test. You should have a complete digestive stool analysis. Destroy it, so you should have a food allergy test. You should have a complete digestive stool analysis. And the diet in the meantime should be extremely limited. Initially, clear liquids, chicken broth, beef broth, and ginger ale mixed with some water to get the fizz out. And to do that for several days, and then start adding in cooked vegetables and cooked proteins. You could use butter, salt, and pepper. So the least amount of variety, the least amount of spices. And then you would want to use NT powder, which is a phospholipid that helps rebuild the lining of the gut. The SBI Protect, which helps with the protein amino acid protection immunoglobulins. Then you would want to be on the probiotic 225 powder. So we mix those three powders all together, SBI Protect, NT factor, and the probiotic 225 into a drink morning and evening before you start eating. And then we, of course, would want to know your blood type, take digestive enzymes, take systemic enzymes, get on vitamin D, get on a very good antioxidant, as well as a good multi-mineral. The next one, Amila says, how would you treat an ingrown toenail in a 13-year-old? Well, she says here her 13-year-old is 108, so we would treat her as an adult as far as size, probably 5,000 international units of international units of vitamin D every day, and then apply Argentin silver, soaking the area 2 or 3 times a day, having that area open to the fresh air. See the podiatrist or your local doctor if you don't see it improving within 24 to 48 hours. Let's see, Karen Smith says, referred by my sister who is a patient, Debbie Clark. My daughter has experienced heavy periods with horrendous clots and cramps for 3 months, never ending. She was told she has fibroids. She had her first surgery about 2 months ago. They removed about 80%. So last week she had her second surgery to remove the remainder. And they found out after surgery it had grown back, and the surgeon said it was the biggest she had seen. So now they have to go back and remove it. She's been anemic through this whole process and very tired. regarding the bleeding. They said they could put her in menopause till everything was completed. Can you tell me what causes fibroids, and is there something that she can do? I think I answered that earlier on. Carbs, sugar, bread, pasta, crackers, cereals, beans, rice, all the sugars, all the fruit sugars stimulate insulin. Insulin stimulates fibroids. Stress stops ovulation, follicle stimulating hormone, and you become estrogen dominant, and that stimulates the lining of your uterus. So you have to find peace. You have to be on progesterone, very high dose, and you have to check her estradiol levels. And the progesterone could be cyclic from day 15 through 25 of her cycle, but if she's very heavy, she could use it day 8 through 28, 3 weeks on, 1 week off. And I would certainly have her make sure that her carb insulin is being checked, check her cortisol. She's estrogen dominant. Get her on the progesterone. And depending, if she's overweight, she needs to lose weight. That'll put her in insulin, hyperinsulinemia, exercise. It's also age dependent. So there's many things I would share with the doctor and try and do. Debbie Clark said, my niece started having heavy periods. Oh, that's a repeat question. Okay. Abby says, hi, Dr. Rita. What are your thoughts about the Dutch test for a hormone imbalance? And she went on saying she's got some irregular cycles and should she test it multiple times? I'm going to say the Dutch test is something that I'm not as familiar with, and I would ask you to see PA Patel or someone who uses this regularly. Of course, the more you test, the better the volume of information your healthcare provider has for you. But in general, aging is stressful, and stress impacts the menstrual cycle, and illness impacts the menstrual cycle. And all of these with aging, as cortisol goes up, progesterone goes down, the estrogen cycle, and all of these with aging, as cortisol goes up, progesterone goes down, the estrogen becomes dominant, the bleeding becomes irregular and heavy, and DHEA, the precursor to help you with your cortisol stress, drops. So you have to have a doctor that will work with you through the age you are and the timing of the cycle. But as far as the Dutch test itself, I do not use it. I am familiar with its components. I know some of my doctors here do use it. That would be, but now that you've had the gallbladder taken out, you do need the bile that will help with digestion. So I would say orthodigestive enzyme with each meal on an empty stomach, morning and evening, a little bit of anti-inflammatory vascuzyme, drink plenty of water, exercise, and then be on our basic nutrient protocol would be 1 iodine tablet, vitamin D, at least 5,000 international units with K2 once a day, a multi-mineral, such as TLC multi-min every day, and an antioxidant like Juice Plus. And that should probably be enough. And probiotics. I would probably use, in his case, Orthospore IG. Miss Kennedy says, I've been taking all of the wonderful supplements you have recommended for me. I would like to know what you recommend for IBS. I also believe I have that. I have been using glutagenics and orthodigestine when I eat. Orthospore IG is a probiotic designed specifically for gas-producing bacteria, and so Orthospore IG is what I would recommend, Colleen. That's what I give my patients with IBS. Danielle Schaefer says she's been taking supplements from Dr. Merrick and addressing multiple issues, and her husband is also on supplements, but their budget is being strained with this. Could you offer a discount to seniors or a family discount? Use of the online store is tedious and time consuming. Could you improve access to online store, please? I'll discuss this, Daniela Schaefer, with Talon. And I apologize, last Friday I was going to try and do a morning talk to the doctor. I couldn't. Last Friday was my 50th anniversary, my 50th wedding anniversary. I totally had forgotten about that. And so I was busy with doing other things. So forgive me for not being there for you. But we will this Friday at 9:30 in the morning till 10 o'clock. So I'm going to ask Talon, I'll point this out for him to look at this and see if there's any way we can be a help to you. Let's see. I think I've answered all the questions from last week now. Yeah, I think I've answered all the questions from last week. So that brings me to this week's questions. Tara Geese says, if thermography report comes back recommending further breast imaging due to vascular asymmetry, what type of imaging do you recommend, mammogram or ultrasound? Well, I think your whole history is the direction and with an exam by your doctor. So you might need both. And the standard of care is an annual mammogram. That's what the state of California Medical Licensing Board recommends. So you should have your doctor know you in particular, your family history, risk for breast cancer, your personal habits, your risk factors, and then go from there. Rosa Ortega says, a friend of mine has a granddaughter who has pulmonary fibrosis. She was diagnosed at age 2 years old. She's now 8. She goes to the hospital about every 3-4 months so they can put a tube down her lungs and give her antibiotics. She stays in the hospital for about a week. Her grandmother wants to know if there's anything you can do to help her daughter with this condition. Well, not to replace her pulmonologist, but things that we would recommend if we had such a child in our practice. We would want to know the blood type of the child. We would want the child on systemic enzymes to disinflame the lungs. We would give the child enhanced chelation to improve the microcirculation to the lungs and all the body. We'd put the child on probiotics. We'd give the child glutathione, which is very important in lung health and surfactant production in the alveoli. We could also give the child this as a nebulized. So there's many, many things that we would do. Deanne Smith said, my niece has pains in her legs at night from her groin to her ankles, which interferes with her sleep. She is O positive and 62. Your thoughts? Well, normally it is mineral deficiencies, potassium and magnesium. So TLC multi-mineral is the direction I would go. I would take the minerals every evening. I would make sure you would have her drink half her weight in water every day and stretch. She needs to do stretching. If that is not alone enough, then I would ask her to use the systemic enzymes, Vascuzyme or Vitalzyme, 5 twice a day on an empty stomach, first thing in the morning and last thing before bedtime. If that's not enough, then I would ask her to make sure she's exercising, walking for blood flow. And she needs to discuss that with her medical doctor as well. Katrina says, you used to be a big proponent of the Kangen water machine. Do you still recommend high pH water? Thank you for what you do. Yes, I do, Katrina. Kangen water that makes it alkaline does so through the added hydrogen ions, and this helps reduce acidity overall. But in the world of things, just getting people to drink enough water at pH 7 and filtered is the greatest goal that I have. But yeah, I'm still in favor of it. Rick C says, can mitochondria be repaired? And if so, How? Thank you. Well, yes, the cell membrane of the mitochondria is made of the same cell membrane of the cell, and the that's made of phospholipids. So you have to eat enough meat, fish, chicken with the skin on it, ham, pork, eggs with the yolk in it, so that you have enough phospholipids, or you take phospholipid supplementations like our NT powder or our biopoly uh, uh, phospholipid pro from Orthobiotics. So you have to put the construction material there to protect the mitochondria, because that's working hard. That's working hard all the time, producing energy and free radicals. It's like your fireplace has to have bricks and a good flute and a chute, and you have to help the structure of that fireplace and the flute be healthy, so that you don't get a house fire from the chute and the breakdown of it. So you check out the chimney sweep, and you check your bricks, and that's the phospholipids. Then the next thing you have to do is do resistance training. Resistance training is where you push against something, and then you work on this in sets until you feel the muscle fatigue. Maybe upper lower body twice a week for 20 minutes. Research shows that will help stimulate mitochondrial repair. Then I would make sure you get a good night's sleep, to bed early, up early. Then take antioxidants to help quench the fire that's cooking in your fireplace of your mitochondria. So we have found Juice Plus to be the most powerful antioxidant with the most research, two of the fruit, vegetable, and the vineyards. Then I would take a multi-mineral cofactor for many of the enzymatic things you need. And then I would take vitamin D, and I would take iodine. So there's that group again: antioxidants, Juice Plus, multi-mineral, TLC, multimin, vitamin D, iodine, and enzymes is what I would use. All right, the next question is from today's questions. Carrie Nicholwitz says, what is your opinion of the supplement Spermadine? Is it okay for people that are gluten-free? I'm not familiar with that, so I can't answer that, but I can look into it. So I'll try and look that up. Robert Bowers, I think he asked this before. He has submitted it. He wants to know if you can do chelation. You can do it as a walk-in. Yes. Jan Barbary says, I've been on bioidentical hormones since 2007, and lately, starting about 6-10 months ago, I started developing a lot of facial and lip hair, not dark, but fairly dense, all over my chin and lip. I think it started when I first tried wax strips to eliminate them. Instead, it just grew it back worse. Is this a testosterone thing, or too much estrogen, or something else? What's causing this? I've never had this issue before. This happens to all women with time, and it is a lack of estrogen and a testosterone dominance of what testosterone you do have. So you would need to have your levels measured, your estradiol, your testosterone, your progesterone, your cortisol, your DHEA, your insulin, and so forth. You need all those things checked with your physician. And I would say estrogen would never, ever cause this, but it's the relative risk. And with aging, we start getting growth of skin tags and all these warts and things. So growth becomes difficult in the body and in the epidermal layer of our body. And so you have to work with that with enzymes and someone who understands it in the natural world. Patricia said, Arzo says, what type of supplements and diet does a person need to be on after emergency surgery for removing the gallbladder? He's 25. I think we answered that before. Vitamin D, vitamin C. We don't make any vitamin C, and when you're stressed, you have to have vitamin C. Surgery is an insult. So vitamin C, vitamin D, Juice Plus antioxidant, be on a good multi-mineral, and be on an iodine, and take, I think that would be probably good enough. I would probably be on a probiotic, eating cooked vegetables and cooked proteins. Find out the blood type of him and use a digestive enzyme when he eats. Melissa Matheson said, best supplement for hair loss, best supplement for probiotics. Been using RS Cosas for 2 months. I'm noticing more hair loss now. I know can be many things. Best supplement to decrease alk phos. Well, the best supplement to decrease alkaline phos is, don't drink alcohol, and use alpha lipoic acid in the realm of 500 milligrams twice a day. But you want to know why it's elevated, because that could be very serious. So you would want to have that tracked with your doctor. I don't know what RS Cosas is, and so there's another thing. So this is how I get benefited. I see what's out there in the world being used, so it's interesting to see what you guys are using. I'll try and look at these papers and look up some of these things so I can stay informed and on top of hair loss. Please, okay, so she doesn't want to use her name. Thank you. She has zero libido. She tried testosterone, but hair falls out, and you get very agitated with testosterone. Please help. So estradiol is what you need. It's a myth. In my experience of 40-some years practicing medicine, the hormone for a woman's libido is estradiol. The hormone for a male libido is testosterone, and never the twain shall meet. And I don't care how many damn books are written about testosterone. It is not the female libido hormone. Now, if you put testosterone onto the clitoris, you will make the clitoris enlarge and become bigger and more impacted during intimate relationships with your husband, and that may, be what you want. But what I want to point out is you can get into trouble with that. So I think that's where all this foolishness comes from. The hormone of desire for women is estradiol. So you need to find a good natural doctor that will give you estradiol and let you go up to 200, 300, 400, along with progesterone, along with monitoring you every couple months, and see the impact and see if this will do it. And it seems to never fail for my patients. And then the last two are, B. Ackerman says, thoughts on bioidentical hormone replacement therapy. I'm reading that you should feel better and see improvements in symptoms quite quickly with hormone replacement. What are your thoughts on this? I know they are not going to magically heal everything immediately, but I'm not seeing much improvement after 4 months. Well, we have to know the levels, and it sounds like you might be being underdosed. We have to know how old you are. We have to know how active you are. We have to know what's in your diet, because hormones aren't the total end all be all. It's an entirety that we need to have as well. So also thyroid, what would you suspect if one is not responding well to thyroid? Again, symptoms not getting better. Have worked on liver, gut, adrenals as well. Lastly, I hear you recommend systemic enzyme for many things. Would you say this is something that you suggest everyone should take? Anyone who's on natural hormone, who's old enough for natural hormone or has a reason to be placed on it, should be on systemic enzymes, yes. The other thing with iodine, your thyroid needs to be tested for a 24-hour urine collection of iodine. Impact many of your issues as well. So I hope you find a good healthcare integrative functional doctor who will allow you to push more of the limits of your hormones and to check your 24-hour urine iodine level and to look at other things as well. And then the last one I have, Stephen Lawrence, is I have been through hormone blockade and proton beam radiation for aggressive prostate cancer 4 years ago. Cancer has returned and is spreading to pelvic lymph nodes. What can I do instead of hormone blockade to stop the cancer? Radiation oncologist, I saw counsels against any more radiation. Hormone blockade destroys my quality of life. Mr. Lawrence Stevens, you have to work with your oncologist. We don't treat cancer here. What we treat rather is we work to help support the immune system and the nutritional state and the detoxing of our patients. There are many things that we can do, and we have patients in your situation. We would put you on iodine, and we'd probably give you high dose iodine, test your 24-hour urine iodine. If you read the book by David Brownstein, a medical doctor, family practice from Michigan. He wrote the book Iodine, and he did an excellent job on this as far as prostate cancer. You know, in Japan, it's very low prostate cancer, and they have about 12. We Americans don't even get, 100 micrograms a day on the average. So I would start with iodine, and then I would put you on high-dose vitamin C intravenously if you were my patient, plus many other testing and nutrient. Then chelation to improve your microcirculation in your immune system. I would put you on a very low carbohydrate diet. I would ask you to become a carnivore. Only meat, fish, chicken, turkey, beef, eggs, ham, and cheese, stuff like that, all organic, wild caught. I would ask you to systemic enzymes on an empty stomach morning and evening with oral digestive enzymes when you're eating your food to help you digest those. High dose vitamin D, we would want teams per deciliter range. And so you would need to be having a doctor that does these things and closely monitor you every 1 or 2, and your alkaline phosphatase levels, things like that. So there's many things that we would do, but we would never answer. We're trying to do everything to build up your immune, your nutritional, and detoxify you, and stick with your advice of your own. We got a 10-minute late start, so I'm going to go to 7:10 tonight, and I'm going to look at the current questions we had today. Up here, Jennifer says, hi, a friend is recovering from kidney cancer surgery a few days ago. What protocol to follow now that he's home? Well, there's just so much to put in there, Jennifer. You know, if they were a patient here, we would want to find out the age, find out the type of cancer it was, make sure they have an oncologist that they're following up with. What treatments are they going to be doing? Was the surgery sufficient? Sometimes removal of the kidney alone is a treatment enough, but they have to have a good oncologist. But then we would do the same thing for your immune system: high dose vitamin C, iodine, high dose vitamin D to get their micrograms per deciliter around 100. Check the antioxidant assay SpectraCell for any nutrient deficiencies, systemic enzymes for inflammation, an extremely low carb or carnivorous diet. So there's many, many things that we would want them to do. Garden Fairy says, I'm taking daily prometrium and bleeding again after less than 2 weeks. Would it help to stop the prometrium for a few days? I will have labs drawn soon. I don't know if you're a patient or not, but what we would suggest is that your doctor should know about this and track you. Given what you've just told me, and you're on prometrium, we would want to know the dose. And if I were your doctor, I would want you to stay on it and get the labs done so I can see what the levels are and then make a decision about up adjusting or down adjusting. But this has to be followed up with your doctor. And I would personally have you to stay on progesterone until you get at least a lab done, and then talk with your doctor about how to manage that. Carol Travis says, hello, I can do the 16-hour fast, but when I try and do a 24-hour fast, I get headaches. I drink half my weight in water. Do you have any suggestions? Thank you so much. Well, I would try and do 18 hours, and I would just be happy there. Work at just shifting it to an 18-hour fast every day. You're good with your water, and I would take systemic enzymes and discuss with your doctor, your age, your diet, your level of exercise, the level of stress in your life, your blood type matters in handling these things. So all those things matter, Carol. So see your doctor. Any supplements that can help get rid of this bacteria, I feel. Well, this Mastagum has been put out there for a long time. Mastagum is a supplement that is involved. You take it and it helps with the lining of your gut. Probiotics are very important. Using digestive enzymes when you eat, having a high level or a good